pain during root canal. Are root canals painful? How painful root canals can be? How can we avoid or minimize the pain during root canal treatment? Is one of the commonest concerns patients have, is one of the most commonest questions when people come to us and say they want to get a root canal done. This is one of the commonest questions which we face. So let's address this particular question in this video. Hello, this is Dr. Arun from Pearls Dentistry, running a dental centers at Chennai, Raja and Amalapuram since the year 2001. If you have not yet subscribed to our channel, please do subscribe to our channel Pearls Dentistry. We've got a whole bunch of videos coming out on dental health and awareness. So when it comes to root canal, of course, we have done multiple videos before and we'll continue to do so. We have spoken about why a root canal is required, how do we do a root canal, all these things we have looked at in other videos. In this particular video, let's address the pain, which is the main concern most of the patients have, pain during root canal. So what we need to understand is, when you get a root canal done, before we start the root canal, the dentist will give you a local anesthetic. It can be for the upper tooth or the lower teeth. Say for example, let's take the lower teeth for an example. So usually when you take say a lower molar, say left lower molar, the dentist will usually give a mandibular block which will anesthetize the entire one side of the lower jaw, one half of the lower jaw. So the lower jaw, the lower lip and the tongue will get completely numb. So subsequently when we do a root canal, usually the root canal is a pain-free procedure. The patients don't experience any pain. So 90-95% of the time there is no pain. But what we need to understand is, for a very small few percentage of people, so when we call it the hot tooth or a hot pulp, in that instance what happens is, the infective process, the inflammatory process is a rapidly developing one. The pulp is extremely irritable and extremely inflamed. So in that instance, the tooth is very hot, it's extremely painful. So in that instance, even when you give a mandibular block, there are chances that the tooth do not get numb for us to open the root canal. The reason being, as I said, because of the extremely rapid development of the inflammation, the tooth is a hot tooth. So in this instances, this becomes a challenge to minimize the pain for the patient. So here, what are some of the steps we usually take to ensure that the patient is having a pain-free treatment? One, we usually advise patient to take an anti-inflammatory and an analgesic pain medication before we start the process. So the pain has already come down, and then when we start the process, the patient is relatively free of pain. Two, we don't do the process at once, but we start opening the root canal in stages. So usually the pressure of the dental drill on the tooth can cause a lot of pain. So when we minimize this pressure by staggering the approach, by slowly opening the root canal, we will be able to minimize the pain. That's number two. Number three, what we do is, so when the pain is, when you're going to do a staggered approach and when you near the root canal, we will usually drop a solution of the dental anesthetic inside the pulp itself. Depositing the anesthetic solution inside the pulp will numb the pulp and helps us to complete the procedure free of pain to the patient. Sometimes, as a fourth method, we keep a sedative dressing inside the pulp. So what does a sedative dressing do? So the sedative dressing numbs the nerve. We usually see the patient 1 week hence, and when we see the patient 1 week hence, we'll be able to give a local anesthetic, do the root canal procedure without pain for the patient. And all these steps are helping to minimize the pain that happens during the root canal process. 90-95% pain-free process, should not have any problem. Only for 5% of chances when the tooth is hot, when the pulp is hot, we take all these steps to ensure that the root canal is done pain-free. More importantly, what's bothering the patient is just not pain during the process, but anxiety that develops for or the fear of getting the root canal done. And usually sometimes it's not only one tooth, they've got multiple tooth which requires root canal, or there are multiple other procedures. So this fear or anxiety can actually drive or can lower the pain threshold, can actually make us very scared to get the procedure done. So in these instances, the best way to get the procedure forward is under sedation. So what we do under sedation, an anesthetist comes, gives a small sleeping dose on the dental on our vein. We sleep on the dental chair, and when we sleep on the dental chair, we'll be able to get multiple procedures, including root canals, done pain-free without any issues. So sedation is a very safe, effective procedure for us to do a multiple dental treatment in one visit and also having it done in a pain-free manner. Hope you like this video. If there are any questions, please do ask in the comment section below. Do subscribe to our channel. Until next time, this is Dr. Arun from Pearls Dentistry. Bye bye and thank you.